Welcome back to Jersey Matters. Social distancing, quarantining, remote learning. The rules of the pandemic have been difficult on all of us, but just imagine if you're someone who needs extra help. If you're developmentally disabled, it's especially hard on them. Here's my interview with Mercedes Witowski, Executive Director of the New Jersey Council on Developmental Disabilities. Thank you so much for joining us today. I wanted to get an overview of what people with disabilities and families who live with people with disabilities are dealing with in New Jersey during this pandemic. I'm certain you hear from them.
Sure. Yeah, that every day. Thanks for having me. So people with disabilities were out of their routines and very difficult to mirror routines when they couldn't leave their homes. So going to work, going to their day program, volunteering in the community. We are fortunate to have at this point in time people accessing their community on a regular basis, and the issues of COVID just really closed down those opportunities for folks. Unlike most of us that have technology, people with disabilities also lack the access to technology, the access to the internet, to get on to these remote and the virtual world that we live in. So that also affected people with disabilities. And for families who still needed to work, but their loved ones were forced home by COVID, they had also significant challenges. They were concerned about leaving their children with someone else who would come in and out of their home that potentially was also visiting other homes. So the issue of contracting COVID in that way. And they were also fearful of, how it was affecting their individual, their loved ones, ability to cope and manage. And very often those signs were, not in ways that people would articulate, that they were depressed or they were anxious.
Right. I imagine you hear from them every day because they're looking for support, they're looking for help. How do you do that?
Well, how do we help them?
Yeah.
What we try by listening, that's the first level of help. We have many town halls that we've conducted for families and individuals to participate in, to tell us their concerns, to react to the different policies that have come out of our state offices that are providing their services, making sure that those policies work in their lives, and where they don't work, helping them to get to a point where the policies could be adjusted. For example, visitation, visiting your child if they don't live in your own home and they live in a home run by someone else. It was important to understand the impact of not being able to visit, or when you visited, not being able to touch your son, not be able to hug or bring them something to eat that they would typically expect. So, listening to families, helping them articulate what it was that was concerning to them, and then working through the system to try to bring about change. And that's generally what we do at the council.
When you're talking about people that live in other homes, possibly some of that I would imagine would be group homes and individuals with disabilities that are in group homes. How have they specifically been affected? You already dealt with the isolation from their family, but it's more than that, isn't it?
Sure thing. I mean, it's the whole routine. And I understand the reason why group homes and providers wanted to limit access, wanted to limit staff coming in and out, keeping to a consistent workforce, and limit activities in the community, even as people began to go out to the parks or go out into town in safe practicing ways. Because people with disabilities often can't follow the same sort of prevention techniques. They don't do well with personal hygiene, perhaps. They don't all do well with keeping socially distant. They don't understand social distance. So those sorts of things, learning to wear a mask for the first time ever. Some people with disabilities just fear masks in general. They fear any kind of face covering. So now to have to wear it to participate in the community is just a huge challenge for folks.
Some children with disabilities, including relatives of my family, are mainstreamed. And so because schools now just announced they're going to go remotely, and they were remote last year, that seems to me like that would have more of a profound effect on those with disabilities than it would on other students.
Without question, Larry. Even in the few months that we were in the remote environment last year, many children with disabilities cannot sit in front of a computer to engage in activities if they have the luxury of a computer. And we're glad that our governor is now in this new school year looking for ways to bring technology to folks, and that was with some strong advocacy. However, just because you have that technology doesn't mean that you can engage in that sort of learning. Therapies, occupational therapy, physical therapy, speech therapy are very challenging in and of itself, and to deliver that remotely also is a huge issue for many students with disabilities.
The state is looking at a huge budget shortfall and trying to deal with that. Things will inevitably be cut. Are you concerned?
Absolutely. We've already started a campaign around preserving service dollars in the budget, before the governor's budget announcement, which we'll see next week. And then we'll continue to advocate for anything that he announces that may look like it will reduce the services and supports, because this is the time that more service and supports are needed. This is not the time that we can see any reductions. People are really hanging on by a thread.
How many people are we talking about?
So the state right now in adult services supports over 24,000 people with intellectual and developmental disabilities, and that's in the state system. A lesser number for children in the Department of Children and Families, a children's system of care.
So he makes the decision next week. Can we talk again after that?
Sure, would love to.
Yeah, good luck to you. I hope it works out for you. Thanks for doing it.
Thank you.
That was Mercedes Witowski, Executive Director of the New Jersey Council on Developmental Disabilities. When Jersey Matters comes right back, people who survive COVID-19 only to find out they're suffering side effects. Now there is a place for them to go. We'll take you there when we come right back.